Hi, how you doing? I'm Firefighter K, and I'm here to talk to you about CPR and bystander CPR. A lot of questions I get asked when I teach this is now that we're going from compressions only, the whole 30 to 2 concept, which was 30 compressions to 2 breaths. People have a hard time with the concept of taking away the breathing for the patient, but we're going to go over why it's important to just do compressions. So when we do compressions, we're building up cerebral artery pressure. So cameraman, you can go ahead and come up this way. So cerebral artery pressure, when we do the compressions, we're building up that pressure because the only thing we care about perfusing is the heart and the brain, so we're going to build up that pressure. So we build up the pressure in these arteries to perfuse the brain. As soon as we stop doing compressions, even if it's for a couple seconds, we lose that pressure and we have to build it up again. So right here we have a concept over time, and we build up that compression factor, and then once we stop to do our 2 breaths, it starts all over again and we build up that pressure. So then we're not constantly perfusing the brain, we're always trying to inflate the arteries. So the goal here is once we just do compressions only, you're keeping that pressure throughout and keeping the brain constantly perfused with no interruption. So I like to use the example of a garden hose. If you're watering your flowers, every time you stop to water your flowers, you don't shut it off at the house. You have a little spigot on the end, and that pressure always stays maintained in your garden hose, so it's ready to go. It's just the same thing. We're keeping that pressure there. If we shut off every time at the house, we wait for the water to build up in the garden hose and to build that pressure up again. So every time that pressure builds up, we shut it off, and it's this constant vicious cycle. So also when we're doing our compressions, we are passively ventilating our patients. There's actually air going in and out and O2 passing over the alveolar membrane and perfusing the arteries that way. Yeah, hold on a second. So we'll go over, do some compressions here for you. And we don't need to count anymore because we're not trying to get to that 30. We are trying to maintain 110 compressions a minute, but that's just a rate. So there's an app you can get on your phone called CPR Tempo for an iPhone. I'm not sure what it is for an Android, but just look up CPR Metronome and you'll get your app. So when you push it, all you have to do is maintain the compressions to that. And you'll just keep doing that for about 1.5 to 2 minutes till someone else is there and they can switch out with you. It's also important to make sure you come completely off the chest so that heart can refill and get a good squeeze next time you put a compression onto it. So just a quick review on that, just so we're all comfortable. We can take away ventilation, so we don't have to do that anymore. They're getting passively ventilated. And the more important thing is perfusing the brain and the heart. And the body will do that for you. So it's already shut down all the other organs, and it knows the 2 vital organs at that time are the brain and heart. So there's plenty of blood in the bloodstream because it's only going to be perfusing those 2 organs. And also you can do compressions to another one bites the dust. That's about 100 compressions a minute, if that's all you got to run through your head. But that's all I got for you. I hope to see you out there, and keep training on bystander CPR and hands-on CPR. Thank you.